Today, Heatherlun and Athena will co-present on the Health Equity Report, which they have developed for Flint and Genesee County. I think you're going to sense the sense of passion that they bring to this project and support for the community. Please welcome Heatherlun and Athena.
Perfect, thank you. Once we get settled. All that to say, we have a whole lot of fun here in Flint doing this work. So thank you so much for this opportunity to come and talk about our work and talk about the report card. We have been excited to do this for some time, so we're excited to be here. Before we get into looking at the report card, I do want to acknowledge our partners who helped us create it. That includes Moses Bingham at the Community Foundation of Greater Flint, Nicole Smith-Anderson and her team at the Greater Flint Health Coalition, my colleagues here at MSU, Drs. Dick Sadler, Amy Drahota, Jennifer Edwards-Johnson, Blair Warren, and our communications person, Jill Vendrasic. And Jill was really critical in helping to position the report card in a larger conversation about access to information, as well as Athena, who is here joining me. And Athena has just done such a marvelous job mobilizing and embedding the report card into community even further. So we're going to start our conversation by looking at what you see on the screen here. So this is the U.S. Department of Health and Human Services depiction of the social determinants of health. Now, when we think about the determinants of health, this includes the conditions in the environments where we all do life, right? Where we're born, live, work, age, worship, and play. And it's those conditions that determine how long we live and how well we live, our quality of life. But, and so let me just give you some examples. So access to healthy food, safe housing, violence, discrimination, racism, polluted air, and the list can go on. And when we address these areas, that's when we move the needle together on health equity. But there's a missing piece. And we saw this during the pandemic, which is information. And this is where those conversations with Jill really just blossomed, because we were able to reflect on MSU's leadership in ensuring that evidence-based information and resources were equitably accessible to everyone.
Good morning. Thank you so much for having us this morning. I bring to you the energy from our beloved matriarch of our community, Dr. Heatherlun. Heatherlun, as she mentioned, we've been able to walk alongside each other for the last 3 years, starting with COVID-19. So what we mean here about digital equity is accessibility to information that is understandable, culturally and locally relevant across multiple sectors and populations. Very often, information or data is buried in a website somewhere and does not reach those who need it most. It does not take into account digital literacy, digital access, and language literacy, the needs of our community. We want to make sure that the information is usable, actionable information, and it is critical to communities, especially for those here in Flint, where access to local data can support data-driven decisions, guide program development, support and alter local funding priorities, and influence policy decisions. But we needed an easy way to share that information and communicate the data to the community, initiating digital tools such as the HERC. Digital tools are not new to the Flint-focused researchers here at MSU. In 2018, the Flint East app was launched in partnership with researchers like Dick Sadler and others, and it still provides information to communities surrounding Flint and Genesee County food systems, including community food pantries, recipes, and helpful food tips. Today, we'll focus our conversation on several sectors focusing on health disparities, the HERC. Thank you. Let's start by defining what a health equity report card is and how it benefits communities like Flint. The HERC identifies and communicates the state of health disparities and differences between different groups by both data and maps. So we are able to document and understand differences between geographic groups such as Flint and Genesee County, as well as the state of Michigan, and also our largest populations here, Black and white residents. But our ultimate goal is to support the community prevention and interventions that attempt to improve health equity for our residents.
So how we went about doing that, let me just tell you, creating this report card was an adventure, but it was a fun adventure that we got to do with our partners. So we did a search of 26 online publicly accessible data sources, places like the state of Michigan, Michigan Department of Health and Human Services, the census, and from that search we identified 50 different data indicators. Once we had those indicators, we then calculated a very simple disparity ratio as the rate of one group over the rate of another group. And the resulting number, then we linked to the grading scale that you see on the slide, where an A is no real disparity all the way up to an F, hey, we got to do something about this. If this isn't being addressed, this doesn't just need to be on your radar, it's on your to-do list and it's at the top. One thing I do want to note, so as we move into looking at the data and the information, just because we see an A or a B, it doesn't necessarily mean that there's adequate health services or resources in that category. It's just telling us, is there a difference between these two groups? So just keep that in mind. So the next thing, we had 50 indicators. So we had to figure out how do we make this a little bit easier to understand and easier to use. So we, along with our partners, we categorized them, and you can see the 6 categories that we have here. So it's health services and access, physical health, mental health, health outcomes, socioeconomic status, and I saved maternal and child health for the last because that's where we're going to focus the next couple of slides of our conversation. So what you're seeing here, and hopefully you can see it, this is the maternal and child health data that's broken down by location. And you can see that we have a comparison between Genesee County and Flint, Genesee County and Michigan, and Genesee County and the US. And I'll draw, as we look at it, we're seeing what? Mostly A's, a couple B's, and a few C's. I'll draw your attention to the top C there, and there's an asterisk there, and that's telling us that Genesee County faces more instances of child abuse versus the US. Whereas if you look on the far right, we see that Flint is facing more instances of children in poverty and infant mortality. There's no asterisk there, and so that's how we identified which group was doing worse or which group was doing better. A couple of things that also might stand out to you, those gray boxes, that was data that we couldn't find when we did that first search. And the other thing that might stand out to you is that we're talking about maternal and child health, and we have 7 indicators. And we know that so much more goes into telling the story of maternal and child health in our community than what you see on the screen. But again, that was what was publicly accessible when we did our first search. On the next slide, you're going to see these same variables broken down by race. And it's a breakdown between Black and white population. It's a comparison between the two, because those are the 2 largest groups in our community. And this one always gets me. This is why we do the work we do. Why Dr. Mona, Drs. Johnson, Andersma, Key, and so many others are working alongside our community members. I've done this presentation, I don't know how many times, and every time you see this, because our community members are represented here. These are their life experiences. Where in Flint and Genesee County, we see more births to Black teenagers. We see across the county more low birth weight Black babies, more Black children in poverty, and more infants and children, more Black infants and children dying.
We'll pause for a moment. When we think about maternal and child health, we have the worst disparities of all 6 categories that we've studied, of these 6 categories. And that's why projects like the Miracle Initiative, the 7-year NIH project, is so important. Together, we are creating interventions to address maternal morbidity and mortality, especially for Black moms in Flint and rural Michigan. Next slide, please. But a picture is worth 1,000 words, and throughout the HERC, you will find maps to help communicate our story. The city of Flint is centered in the middle of the map. You will see here that the concentration of Black residents is indicated by the gray color. The purple shows life expectancy, where the darker the purple, the longer you are expected to live. In this area, there's a difference of about 20 years. That spans from 65 years in the light purple to nearly 85 years in the darker purple. But the work isn't stopping here. This information is moving forward. Flint Innovative Solutions has been supporting the community with digital literacy training for over 5 years. This also includes training on how to use the HERC, how to interpret the data, and support digital literacy for community to optimize this tool. Additionally, our research team and Project 2 of the Miracle Initiative, which I happen to be the community PI, introduced the HERC to contestants in our Flint Apathon. The data provided in the HERC help those contestants design, as we're currently in the process, designing the digital intervention and introduction for the PC-Prem Michigan Healthy Moms, or My Mom, mobile app, which aims to reduce pregnancy deaths and complications with the focusing, again, of helping Black and rural moms.
I hope that as you look through the report card, you see lots of opportunities. Opportunity for more data, for better data, to fill in those gray cells, to add to those categories. If you look at the mental health category, I think we have 4. And we know that there's so many more variables that should be added to that. And our community partners are committed to helping us fill in those gaps. So I want to share a quick story. Nicole Smith-Anderson, I mentioned her, she's with the Greater Flint Health Coalition. She was in a meeting with the National Kidney Foundation of Michigan, right, talking about something completely different. Kidney Foundation just launched this wonderful data dashboard. And Nicole sends an email and says, hey, the 2 of you should get together. Kidney Foundation wants to spread their word, and you need more data in the HERC. So we, in the next iteration of the report card, I'm so happy to report that we'll be including that kidney data in our next report card, because our community is committed to doing this work and investing in these tools and doing this work together. But MSU is too. So because of funding through MSU's ACORN initiative, led by Dr. Kara Poland, we were able to create a substance use disorder specific report card. We did this with Odyssey House, another wonderful community partner, and it's focused on the Port Huron and St. Clair County community. So it's on our website. I hope that you get a chance to check it out. But we're also committed to our students. So we've been able to share the information from the report card with our med students, exposing them to the disparities and the experiences of our community partners, where our med students are going to be living and learning and working and serving in. And we're also going to explore the opportunity for the med students to do some behind the curtain work and help us identify data, help us to format the report card and support future iterations of its creation, and as well as embedding the report card in our Master of Public Health courses. But I want to bring us back to community. So the report card isn't new, right? The data isn't new. We centralized it and we put a focus on disparities. And it's certainly not new to our community partners whose life experiences are represented on the pages of the report card. But what is new and what is Synergy Unleashed is that we're doing this together. We're co-creating these resources, these digital tools that Athena mentioned, with our community partners, so that together we can guide change and we can improve health equity for everyone.
Thank you so much for this opportunity to present. I do want to lift up some of the things that Heatherlun and I have been able to work on. We mentioned COVID-19, working together on the NNICE project. Through continued effort, we were able to translate that into Spanish, also into Arabic. As Heatherlun pointed out, there's data missing, and so it's our job collectively to make sure that everyone is included in the report cards. Thank you so much for having us this morning.